How can I help you this beautiful morning?
You got any cases?
3. Got a teenage African-American lung transplant
Next 2 days you'll be doing nothing but clinic work.
I just said...
You were lying.
Well, then why'd you ask?
Because if you told the truth, I was only going to give you 1 day of clinic duty.
That's dishonest. I refuse to participate
You'll
in this.
do it. You owe me. I kept you out of jail. I can put you back.
Perjurer.
Felon.
How can I help you this beautiful morning?
I told the nurse I have a runny nose, but I don't. I think I have syphilis or gonorrhea.
I think I have an STD.
I think I have a...
You ordered a CT on a patient with a bug in his ear.
How did you know I was here?
Ran into Cameron in the clinic.
Ran into?
You ordered pointless tests just to...
Wouldn't have been pointless if you didn't run into Cameron.
She got punished. She's stuck with another dying patient. Is that Vicodin?
Breath mint. Thought you were gonna kiss me.
What happened to rehab?
I got out.
It was a scam.
Enough foreplay. You gonna kiss me or not?
You are going back to the clinic or jail.
You perjured yourself to keep me out of jail. How are you gonna...
I only did that because I thought you were getting clean.
So it's do clinic duty or go to jail.
Yes.
And then it'll be finish your paperwork or go to jail. Help with fundraising or go to jail. Do your job or go to jail. I think I'd rather go to jail.
You owe me.
Beautiful.
Thank you. It's dry.
Who cares? It's beautiful. If my lawn were half as well maintained as that, pigeons wouldn't have the nerve to poop on it.
Good grooming is important.
Is that a shot?
People do judge you on your appearance. When you entered, I noted your shirt hadn't been pressed. You hadn't shaved in quite some time. I extrapolated you are a person for whom detail was not a major concern. I was worried you might apply that same standard in your
You
work.
use toenail clippers up there?
They're longer, so they allow me to better reach the upper hairs.
I'm wearing a rumpled shirt and forgot to brush my hair this week. You've got athlete's foot in your nose. I'm ready to be judged. Okay. $50 to any patient who is willing to leave here right now.
House. You can't.
My money.
I don't care. People do
They'll
not.
leave for $50. They're not all that sick.
Or they're poor and desperate, which is why this place is here.
If they're that poor, then they'd rather have $50.
Can I have the money?
Look, it's monogrammed. He doesn't need money. Ergo, he's not sick.
And the blood?
Yeah, it could be anybody's. Monogram's definitely his.
We need to talk.
Doesn't matter what you say, do, or threaten. I will find a way out.
How can we make this more interesting for you?
How can we make the sky green? How can we make the tall short? You cannot make the uninteresting interesting.
I'll pay you $10 for every patient you diagnose without touching. You pay me $10 for everyone you have to touch.
You're making this into a game for me, from which I can only conclude this isn't a game for you.
No.
Why? You think if I deal with enough people, I'll find some humanity?
Yes.
Why I have to do this myself?
I got a bum leg. Say ah.
Feels rough.
Yes, it's a rash. I'm gonna need more than rough.
Well, it's just rough. Can't you feel it?
Well, I could, but then what satisfaction would you get?
Got it.
Start counting. How many?
26.
Okay, either you suck at math or you're gonna die in 2 seconds. You suck at math. Diagnosis, prescription. You owe me 30.
Test results are back for your STD patients. I'm not paying you for them. You already touched them.
How old are you?
30.
And you've never seen an after-school special? Dawson's Creek? How do you get to 30 and not know about condoms?
Oh, God, I have an STD.
No, but you will. Every patient who comes in here for an STD test has one thing in common. They had a SWS, sex while stupid. How old are you?
60?
You're lying. That's not the point. Have you never seen Dawson's Creek?
I feel good.
That's your complaint. Your major symptom.
I told her this was a waste of time.
I notice colors more. And music, I'm really hearing music. I'm 82, and I'm supposed to be playing canasta with the other old ladies, but now, when I see a guy with a cute butt, I can't stop looking at him. Or a sexy beard.
And you figure that enjoying cute butts is a sign of disease.
It all started a month ago when Mark rented Gone with the Wind for me, but it had the wrong DVD in it.
Oh, right. I forgot. This is all my fault.
Of course, he was too busy to bring it back.
Yeah, like I don't have a life.
So I watched it, and it had this actor in it, this kid called Ashton Kutcher. Now, I think about Ashton all the time. All the time. You remind me of him. Same bedroom eyes.
People are always mixing us up.
I suppose you need to check my heart.
No, that won't be necessary.
I told you.
But I am going to admit you to the hospital for tests.
What test? She's just old.
And you're just insufferable. Your mother has had a sudden personality change. It should be checked out. I'll have a nurse come in and admit her. I'm too handsome to do paperwork.
The healer with his magic powers. I could rub his gentle brow for hours. His manly chest, his stubbled jaw. Everything about him leaves me raw.
Psych ward's upstairs.
With joy. Oh, House, your very name will never leave this girl the same. It's not bad for an 82-year-old. She asked me to give that to her true love.
What can I say? Chicks with no teeth turn me on.
That's fairly disgusting.
And that's ageism.
You better watch yourself around this babe. Here are her test results.
Oh, Dr. House.
Well, it took you long enough. We've been waiting here.
Mr. Adams, would you step outside for a moment?
Why?
Because you irritate me.
He is my son, Doctor. He's just a little cranky from not eating.
Fine. Mrs. Adams, have you had any recent sexual activity?
What?
Well, I don't suppose fantasies count.
Oh, my God.
Unfortunately, I've hit kind of a dry spell. Only for the last, I don't know, 15 years.
She's confused. My father died 8 years ago, a heart attack.
Not in bed, dear. Why do you ask?
Because you have tested positive for syphilis.
That's impossible. And insulting.
I don't think it's the first time that Mom has heard this diagnosis.
Cupid's disease. That's what we used to call it.
When did you get it?
1939. Prom night, I think. He had a Chevrolet. It was before I met your father.
You said Dad was your first love.
He was. We're talking about sex. But I was treated.
Which suppressed it. In your case, for 60 years. But now it's back, and the spirochetes that cause syphilis are eating away at your brain cells.
Oh, that's revolting.
It's not as revolting as chlamydia. It's got seepage. And it's the 21st century. We got flying cars, robot dogs, penicillin. High-dose regimen for 2 weeks, you're cured.
I can't believe this.
Yeah, well, pinch yourself.
I guess for the next 2 weeks, I better practice safe sex.
You'll be fine. Just feed that cranky kid.
Experiencing fatigue and weakness.
Wouldn't have anything to do with the fact that you're 102 years old.
Usually he's strong as an ox.
102-year-old ox.
He has tingling in his feet and his legs. I want a full battery of tests.
Carbon dating?
I'll pay cash if it's not covered.
Well, it's nice of you to float your friend.
He's not my friend. He's my father. He's 22 years older than me.
Well, that's true. He's definitely had his jowls done. Statistically, if he didn't have these symptoms, he'd be like most people of his age. Dead for the past several decades.
Do the tests, I'm sick.
You have a bad case of natural causes.
Do the damn tests.
If the vial fills with sand, we take that as a bad sign.
Dr. House!
Don't tell me. Your father's hairline is receding and he needs more tests.
He's 102. His next test is an autopsy. Look, I love the old man, but I gotta get him out of the damn house. He can't do anything without me. He needs to be in a care facility.
Well, so tell him. He's a big boy now.
I can't. I'm his whole life. But if it comes from a doctor...
That's very generous when you were 30.
Pretend to run the tests, and then tell him he can't live with me anymore.
Forget the tests.
I think Junior might have a few words to say about that.
I love him, but he can't let go.
$40 says he can.
I can't do anything without him helping me like I'm senile. If I go back there, I'm gonna rip his throat out.
You sure you won't warm up to him over time?
Skip the blood work. Tell my son it's grim news. I need to be in a nursing home. A private room. Make it a suite.
Be our little secret. I've got your test results. You have the metabolism, blood counts, liver and kidney function of a 92-year-old, which is great because you're 102. What's not so great is the average life expectancy is 78. It is my recommendation that you move into a home with round-the-clock care.
I can't believe it.
Can't my son give me round-the-clock care?
Not unless you've done your 2-year certification in Tiburon swab technology.
There must be some other way. Just because he has a little tingling and some trouble feeling hot and cold and some difficulty...
You can't feel hot and cold?
Not lately, but at my age.
Show me your teeth. Dentures, fairly worn. I'm guessing 10 years old. Show me your denture cream.
Why would he carry denture cream?
Because he has zinc poisoning. To get it from denture cream, you have to take so much of it. Trust me, he never leaves home without it.
How much do you use, Pop?
About a tube a day. I buy it online. So what does this mean?
Bizarrely, it explains all your symptoms. Better fitting dentures, you'll be fine. Medically, there's no reason to go anywhere. Hospital rebate. You might want to put it towards couples therapy. And you've never seen an after-school special. How do you live to your age and not know about condoms?
I have an STD.
Yeah. You're actually the first one today. Lucky day. Well, not for you, but you gotta feel good for everyone else. It's chlamydia. As bad news goes, it's about the best. Oh, settle down. It's treatable. It's actually curable. All you gotta do is take these pills.
Don't touch me!
Someone to cover a patient.
House, you committed to...
She was raped. You think I'm the right doctor for her?
We've assigned another doctor to your care.
I didn't mean to upset Dr. House.
He knows that. That's not why we're doing this.
I like to keep being treated by him.
Why?
Just do.
Well, trust me, it's better if you deal with somebody who specializes...
I'm fine.
You told Dr. House it's been less than a week. You haven't told anyone other than him. Emotionally, you're still...
You know what I'm dealing with? You know what I'm going through?
No. You think Dr. House does? I'm not suggesting either one of us be your doctor. Dr. Stone is a psychiatrist.
Dr. House is too busy. I could wait.
Why do you want me?
I don't know.
I don't want to treat you.
You're just saying that so I'll see the psychiatrist.
True, except for the word just. I'm saying I don't want to treat you so you'll see the psychiatrist, and because I don't want to treat you.
Why don't you want to treat me anymore?
I never wanted to treat you. The fact that you were raped holds no interest for me. It's nothing personal. There's nothing to treat. You're physically healthy.
Okay. But I want you to be my doctor.
Why?
I don't know.
Well, you gotta have a reason. Everything has a reason.
I trust you.
I see that's a bad reason. So I'll lie to you. I'll tell you anything just to get you out of here.
I don't care. I want to talk to you.
Look, you were raped. And all control was taken away from you. You're trying to find that control again. You want me because I don't want you.
I'm raping you.
In a very non-invasive, more annoying than traumatic.
Get the hell out of here.
I'll send in Dr. Stone. How long has Stone been in with her?
Are you concerned?
You know how many people get raped every day?
So it's common, therefore boring.
If we were to care about every person suffering on the planet, life would shut down.
How about just the ones we meet?
They deserve our sympathy more than the other people.
So your solution is not to give a damn about any of them. How do you do that? How do you take that theory and put it in fact?
What happened?
Pills, benzos. We need to get her stomach pumped.
Respiration shallow.
What did you say to her?
Nothing that would make her want to.
Heartbeats irregular.
What did she say to you?
Nothing. I gave her a couple sedatives, turned around, she grabbed the whole bottle.
You must have said something.
I said plenty. She said nothing. I was with her for over an hour. She didn't say one word.
You gonna do that again? You're gonna be okay, physically.
Which is all that interests you. You're here.
Under orders.
How would you tell me that?
So I don't like hypocrisy.
But you don't have a problem with cruelty?
Which brings us back to, why do you want me?
I don't know.
You tried to kill yourself because you couldn't talk to me. You must have a reason.
Why does there always have to be a reason? Can't we just talk?
Here's a phone. Talk to a friend, family member. Call the police.
If she wants to talk about the weather, talk about the weather. She wants normalcy. She wants to feel like the world didn't end.
Right. I'll tell her that everything went on without her. Babies were born, people got married. Thousands of people will remember the day she got raped as the happiest day of their lives.
You might not want to phrase it quite that way.
You need to get her to talk about what happened.
No, he doesn't.
Pretending it didn't happen.
Wrong. Pretending this didn't happen is the best thing she could possibly do.
She's got to make this real.
You know what we should be trying to make real or process? The few decent moments in our lives, not the crap.
Maybe you're right. Except there's no way she can pretend this didn't happen, so she has no choice but to process it.
You gotta tell me what happened.
You don't really want to hear.
Sure I do.
You're lying.
This doesn't have to destroy your life.
I know.
It doesn't mean anything about you. It wasn't your fault.
I know.
You did nothing wrong. Some jerk hurt you, that's all.
I know.
You're worried that you can never trust men again.
No.
Statistically, there was always a chance this could happen. The fact that it did happen doesn't change anything. The world doesn't suck any more today than it did yesterday.
I know all that.
Well, then what do you want me to tell you?
Nothing. I just want to talk.
About nothing. If we talk about nothing, nothing will change.
It might.
How?
Time. Time changes everything.
That's what people say. It's not true. Doing things changes things. Not doing things leaves things exactly as they were.
I need treatment for my type 2 diabetes.
There's absolutely no part of that sentence that is true.
I've been experiencing weight gain, fatigue, and sluggishness.
Weight loss is a symptom of diabetes. Fatigue is a symptom of thinking you have a disease you don't actually have. And sluggishness is a synonym of fatigue.
I need insulin. I know it.
Much as I'd like to kill you by dangerously lowering your blood sugar, murder violates my parole.
That blood work is weeks old. Test me again.
I am the test. The test is negative. The test also thinks you're a giant pain in the ass. That last insult was your cue to leave.
Test me.
Fine. Wait right here.
Thank you.
Sleep study. Please make sure he's not disturbed for the next 8 hours.
Test my urine.
Looks like I was wrong about my diagnosis.
Yeah, I have diabetes.
No, but you're not a hypochondriac. Or you would have imagined some new disease after I shot down the first one. So whose urine is that? Diabetic girlfriend without health insurance?
It's not a scam. I'm sick. Now I have swollen ankles.
Medical term is cankles. Is there some black market in insulin that I don't know about?
It's in my genes. My old man got diabetes at 50. My older brother got it at 50. I just turned 50.
Well, that's a great argument if diabetes was a gold watch.
I got sciatica like my dad. Class 4 hemorrhoids like him. I need to get a jump on this thing.
You have to stop the transfusion.
You gonna test my urine or what?
Not diabetes. Apple juice. Easiest way to fake a spike in blood sugar.
Dr. House?
Unless you're a locksmith or an electrician with political contacts, I'm busy.
My husband saw you in the clinic. Wants treatment for diabetes.
My condolences on your forthcoming divorce.
He keeps imagining symptoms. And now I have to make him these awful anti-diabetic meals.
Since I have no intention of testing him, treating him, or cooking for him,
Could you write me a fake prescription for insulin?
The advantage of fake prescriptions is you don't have to be a real doctor to write one.
Just tell me what's safe to inject in his thigh. His symptoms will go away, and then I can show him he was never sick. Water?
Imaginary medicine is not my specialty. I do have an imaginary colleague who's just sent me an imaginary page. Imagine how sorry I am. Cankles.
Is there some problem with the prescription you gave me?
I'm faint. I've been gaining more weight. I think I need a bigger dose.
If you double his placebo, you might drown. Also, you forgot to mention that your heart rate is slow.
My heart rate is not 52.
Technical term is slow. Those awful anti-diabetic meals you eat, they contain bok choy.
A pound of it every day.
Bok choy has glucosinolates, which inhibit thyroid function and account for all your symptoms.
So, this isn't diabetes?
You have a bad case of irony. The food that you're eating to stop making you sick is making you sick.
And maybe I don't have my father's crummy genes after all.
On the other hand, maybe you're fat enough to get diabetes even without him.